Hello, my name is Tristan Hutchison, and this is the oxygen and administration skills video. I want to make sure I have all of my supplies needed for this skill video, and I have the nasal cannula, I have the non-rebreather mask, gauze, and gloves. Okay. First thing I'm gonna do is make sure when I walk into the room, the door is closed or the curtain is pulled to make sure there is patient privacy. Second thing I'm gonna go ahead and do is walk into the room and make sure I use proper hand hygiene. Okay. The next thing I'm gonna do is I'm gonna introduce myself to the patient and then ask for two patient identifiers. Okay. So hi, my name is Tristan, and I will be your nurse today. Can you please tell me your first and last name and your date of birth? Great. Okay. I would make sure that I would check the wristband as well to make sure that the name and the date of birth matches with the wristband. And so it does, so I have my two patient identifiers. The next thing I'm gonna do is I'm gonna explain to the patient what we're going to do next. Okay, Mr. Smith, we're gonna go ahead and do an oxygen therapy. Your doctor has ordered some oxygen for you. Apparently your oxygen levels are a little low. So what we're gonna do is apply a nasal cannula and begin the oxygen, okay? So the next thing I'm gonna do is go ahead and put on my gloves. And at any time during this process, if you have any questions, sir, go ahead and ask away. Okay. All right, got my gloves on. I'm gonna go ahead and I'm gonna get my nasal cannula. Okay, so you got the nasal cannula here. All right. Okay, so this end here is actually going to be attached to the flow meter that is on the wall. And the flow meter, there's going to be two dials. One is green, the other one is yellow. The green dial is for oxygen, is labeled oxygen, and then the yellow dial is air. But we're going to make sure that we put this on and dial for the use the green dial for the oxygen. Also, the normal range for the nasal cannula is between 1 and 6 liters. For the purpose of this video, we're going to go ahead and state that the doctor has prescribed 3 liters. So 3 to 4 liters of the humidification. Humidification prevents drying of the nasal and oral mucous membrane. Okay. All right. So we have this attached, and I've adjusted the dial. You see the ball up to 3 liters. Okay. All right, Mr. Smith. So now the next thing we're gonna do is these right here, these little tubes are gonna go into your nose. You put this in your nose, and it's gonna go down here, like so. Okay. Going there like this. Okay. Then I'm gonna take this side and take the rest and take the tube and put it around your ears on both sides like this. Okay. All right. Put it on there. And then this portion down here, it has a little secure little tube that comes up so we can secure it against the patient's chin here so it doesn't fall where it's unstable. Okay. All right. Got this adjusted. Comfortable? Perfect. Okay. The next thing I'm going to do is make sure I check every 4 hours for skin deterioration. Make sure that there's no redness or irritation or breakdown. Now, if there is, the thing I can do is we can take gauze, and we can put the gauze one here on the cheek here. Okay. Can put another one on this side of the cheek. My mannequin is a little unstable. I'm trying to keep it stable. Okay, and then could put one around in his ear as well, because he can get skin breakdown on the ears. And then one on this side of the ear as well. Okay, perfect. Okay, sir. The next thing is your doctor came in, or your doctor put in another prescription for oxygen for the non-rebreather mask. Okay, So what we're going to do is take off the nasal cannula, and we're going to go ahead and put on the non-rebreather mask because your oxygen level is still a little low, okay? So next thing I'm going to do is go in and take off the nasal cannula. So I'm going to go ahead and remove the gauze. Okay. And put these in the proper receptacle. The next thing I want to do is loosen up this tube here, okay? I'm going to go ahead and pull this off the ears, this, and remove that. Okay, sir, we got this off now, okay? This is going to go into the proper receptacle. The next thing, now we're going to go ahead and get the non-rebreather mask, okay? These will go in the proper receptacle, okay? So this portion here, the bottom here, is going to go onto the flow meter like how it was with the nasal cannula as well. So we're going to put this on the flow meter. We're going to make sure it's on the green dial, which is the oxygen dial, okay? The normal range for the non-rebreather mask is between 10 to 15 liters. For the purpose of this exercise, for the skills video, we're going to state that the doctor prescribed 10 liters, okay? All right, I have that inside. I have that attached to the flow meter, and I adjusted the level to 10. You can see the balls right there, okay? Okay, sir, next thing, the next thing I'm gonna do as well is we need to make sure that the reservoir bag is halfway filled before we put this on to the patient. So what we can do is we can put our finger on this and on the inside and make sure that the reservoir bag to fill it quicker. So now since the reservoir bag, pretending that it's already halfway filled, we're gonna go ahead and put this on the patient, okay? Okay, sir, we're gonna go ahead and we're going to apply this mask onto your nose, and it's gonna go over to your mouth, okay? Goes over your mask, your nose, and then this is gonna go over your head like so, okay? All right, okay. So, and then the little metal piece over the nose, we're able to clamp it down so it can fit in a nice form fitting around the nose. Then next we have these little strings here that we can pull to tighten it up a little bit more around the face, okay? Are you okay? Perfect, thank you, okay. What we're gonna do is every 4 hours, just like the nasal cannula, we're gonna check for skin breakdown, make sure there's no irritation or redness. However, if there is, we're gonna go ahead and put the gauze around the cheek, like how we did with the nasal cannula as well. Okay, so trying to keep my mannequin in place. Okay, as well as the ears. Okay. Do the same on this side. Okay, also, if the patient is complaining of it irritating the metal piece, irritating their nose, or if you notice there's any skin irritation or redness around the nose, you could do the same with the gauze. Just go ahead and lift up the mask, put it underneath the metal portion, and apply it to the nose. Go ahead and clamp that down, and that should be able to help as well. Okay, Mr. Smith, is everything okay? You feeling all right? Perfect. Okay, so the doctor came in and stated that, everything, you're no longer need oxygen, and that you're okay to quit the oxygen therapy, okay? So I'm gonna go ahead and remove that non-rebreather mask, okay? All right, so I'm gonna go ahead and take off the gauze. Okay, perfect. All right, I'm gonna go ahead and take off the mask, okay? Go ahead and apply this into the proper receptacle, okay? All right. Okay, are you comfortable, sir? I make sure I put the patient up in an upright, comfortable position, ask if there's anything else that he needs, and just let him know that I'm done with this portion. And then I would provide a call light and let the patient know there's a call light here if you need anything. And then from there, I would go ahead and I would take my gloves off, okay? And then make sure I put this in the proper receptacle, do proper hand hygiene, and then I would document exactly what happened with the whole oxygen administration and what the doctor has prescribed from the nasal cannula to the non-rebreather mask. And then that's it. Great, thank you.